We have a serious hip MMT emergency. We have over 12 tests to do in less than 10 minutes. This is crazy. Oh. All right, so we're going to do one against gravity and one gravity minimized position for all of the MMT positions for the hip. So first we're going to do internal rotation. Remember, with all of these, to check and verify full range of motion. That is a key component to making sure that we are grading appropriately. So first I'm going to have her do internal rotation against gravity. And then checking full range of motion. That's good there. I'm going to bring her back in just a little bit. We're trying to get about that halfway point on the positioning. So I'm going to be holding on the inside of the femur and pushing on the distal tibia here, or fibula here. So on 3, 1, 2, 3, hold, hold, hold. All right, so she was given pretty early into that. So I'm going to give her a 4-. Patient went through full range of motion against gravity, held min to mod resistance before braking. We're going to go ahead and do the external rotation here before going to the gravity minimized, just to reduce the position changes. So now she's going to externally rotate. Awesome. Checking full range of motion. Hand's going to be on the outside. I'm going to lift up just a little bit so you can see, and then I'm pushing on the tibia here, so the medial malleolus. So on 3, 1, 2, 3, hold, hold. All right. So she was able to tolerate more pressure on that one. So patient went through full range of motion against gravity, held moderate resistance before braking. I'm going to give her a 4 on that. Now, if she went through no range of motion, couldn't move at all, and then I checked to see that there was, the gravity minimized position is supine. So now she's going to get supine. We'll do gravity minimized for internal rotation first. So you need to fully externally rotate. And then literally all the patient's going to do, you can hold on if you want to. You're not helping. You're just trying to reduce some friction. And she needs to try to roll her leg in. So can you roll your leg in? And once that kneecap gets over the top, it just kind of falls over. So that should be easy. Once it's straight, that's pretty much going to tell you full range of motion. So patient went through full range of motion, gravity minimized position. That's a 2. So that was internal rotation, starting in external, going to internal. External rotation now, we're going to internally rotate. This one's probably going to be a little harder because if someone's weak this week, normally your hips rotate externally anyway, so you might have to help initiate that. So go ahead and try to now roll your leg out towards me here. And I'm just there holding it up off the table. Patient went through full range of motion, gravity minimized position. That is a 2 as well. So those are one example of gravity against gravity position, another example, gravity minimized. Now we're going to do hip flexion. So if you could sit back up for me off the edge of the table. And I know this is weird. She's already starting in well over half the range of motion, but this is what it is. So you're going to have her try to lift this knee up as high as you can. Awesome. And then depending on the person, you might have a firm or soft infeel. So she went through her maximal range of motion. So then I'm going to bring her back to the middle position here. I'm going to push on 3, and I'm going to hold this shoulder so that she doesn't lean forward or back. On 3, 1, 2, 3, hold, hold, hold. All right, awesome job. So patient went through full range of motion against gravity and held moderate pressure before braking. I'm going to give her a 4 on that, okay? Now, if she couldn't move at all, she's going to be laying on her right side. And then go ahead and slide back towards me a little bit more. So I'm going to cradle this leg here. You can bend this knee. There you go. So we're going to cradle this knee. You're going to start in a neutral extended position and then try to have her bring her knee up back towards her stomach. So go ahead and do that. And I'm just holding up so she doesn't have to abduct. I'm doing nothing to control that motion and deflection. She went through full range of motion in a gravity minimized position. Again, that's a 2. So now let's do hip extension. So getting prone. This will be our against gravity position. Patient's going to try to extend, so keep that knee straight and lift this leg up as high as you can. Awesome. Verify full range. Beautiful. I'll set her back down. Now with this, you see my hands in the low back. Don't be pushing on the low back. Really all you're doing is just kind of feeling if that pelvis is tilting. But if you're leaning on this, all you're going to do is hurt somebody's low back. So I'm just kind of feeling that pelvis here. So if someone has knee problems, then you want to push at the distal femur. Otherwise, the normal position, unless you specifies in your documentation, is going to be the distal end of the tibia down here. So go ahead and lift your whole leg up again. I'm going to push on 3. 1, 2, 3. Hold, hold, hold. Awesome. And relax back down. Say patient went through full range of motion against gravity, held strong or maximal resistance without braking. So I'm going to give her a 5 on that. Now, if she couldn't do that, I'm going to switch legs just for the sake of this demonstration. Now we're going to look at the left leg. If she couldn't lift up at all and she has motion, go ahead and roll towards your back towards me this way. Cradle that leg again. There you go. And then I'm going to have her start neutral and then try to extend that leg back towards me. Awesome. That's all her. Verify full range of motion. Patient went through full range of motion. Gravity minimized position, that's a 2. So we've gone over rotations, flexion, and extension. Now we can stay in this same position for abduction of the hip. So again, keep this. If you bend this knee, it gives them something to lay on besides their greater trochanter. A little more base support makes bounce a whole lot easier. So with these, make sure that they're in a nice straight line. If she starts to flex her hip more, then it's more TFL kicking in. We're trying to get a little more glute med in this situation. So verify range of motion or have her lift up. So abduct as much as you can. Watch making sure there's no rotation of the hip occurring. Verify a little bit more. Awesome. Go ahead and relax in my hand. So, always give people a chance to kind of regain their composure before you actually push. So I want you to hold this position right here in a second. Now with this, just like with hip extension, if there's any knee issues, pushing down here, which is the normal spot on that lateral malleolus, that is the preferred spot. But if they have any knee pain, that seems kind of silly. So again, push distal femur. If you push on the distal femur, you just need to document that that's where you did it. And that's where I'm going to do it today. So go ahead and lift up right there. Hold that on 3. So, and I'm going to make sure she doesn't roll forward. On 3, 1, 2, 3. Hold, hold, hold. Awesome. Bring that sucker back. Patient went through. Full range of motion against gravity. Held moderate to strong pressure before braking. She's getting a 4+. Fantastic job. Now, if she couldn't lift at all, she's going to be supine. Again, you're just going to have to cradle this leg, and she's going to go parallel to the ground. So, I'm going to hold up here, then try to swing that leg out towards me as far as you can. Awesome. Then I'll pull a little bit, firm infeel. Patient went through full range of motion in a gravity minimized position. That's a 2. So now, hip adduction. So let's go ahead and lay facing me. This is a weird one. So you're going to cross this foot over. We're testing the left leg here. So again, making sure things are straight. So it would be better if I was on the other position, but this way you can get a better view of what's going on here with this leg. So lift this leg up into adduction best you can. Lift up. Perfect. Go ahead and lay back down. Same concept applies to knee safety. Yes, pushing here is the default position, but I'm not trying to do anything to someone's knee, so I'm pushing distal femur. Again, if you push distal femur, since it's not the standard push position, then you need to make sure that you document that. So, and I'm going to control that pelvis, make sure she's not rotating back or forward. Go ahead and lift up again. On 3, I'm going to push. 1, 2, 3. Hold, hold, hold. Great. Relax. Patient went through full range of motion against gravity, held max to strong pressure without braking. That's a 5. Say she couldn't move at all. So go ahead and lay back supine for me towards the edge of the table. And then straighten this leg out. Awesome. So slide this leg over just a little bit here. Again, I'm going to cradle and then try to adduct as far as you can. Great. Fantastic. That's her full range of motion. Patient with the full range of motion, gravity minimized. That's a 2. So we've covered one example of gravity against gravity and gravity minimized for all of those. Now there are tons of different nerves, tons of different muscles for all these hip actions. So that's why I'm not going over any one specific. We can do that in lab, but just check your MMT book on the preferred muscle to pick. And we'll talk about it in class on which one we can kind of all agree on. But there's a lot of muscles for that. So make sure you check that out. And that's some basic rundown of some hip MMT. Awesome job. Thank you.